Hey guys, welcome back to Confessions of a Doctorholic. It's your girl, Dr. Slayman, or just Hafsa. And today's episode is about one of the coolest, wildest, and bloodiest cases I've seen so far. Let's talk bypass surgery. Fake veins and mid-op emergency that honestly felt straight out of a medical drama. Stay tuned. So, I scrubbed into my first bypass surgery today. I was so pumped because I've always pictured these being done with a vein graft, like harvesting a real vein from somewhere else and sewing it in place like the body's own plumbing system. But nope. This one was done with PTFE, which is basically a synthetic graft. Kind of like the IKEA version of a blood vessel. Flexible, efficient, not real, but it gets the job done. And I'm not joking. Like literally, that thing that they have in IKEA that covers wires? That's literally what it looked like. Anyway, our patient rolls in and let me just say, I did not do the best job prepping him. It wasn't horrible, but let's just say he probably didn't get the full Brazilian he needed before surgery. And yes, I know, we're doctors, we're professionals. Hair's part of the field prep, but still, I'm human. Some things are just not my favorite part of the job. Once we got him properly draped and scrubbed in, the case got so good. We started with a long incision, layer by layer, making our way down to the artery. And then it became this rhythmic flow. Tie, cut, again and again. Honestly, it felt like choreography. We looped vessels, clamped off segments, and prepped both the groin and the knee area so we could connect the top and bottom of this bypass. Now, the clamps we used were these weirdly blunt, curved, bulldog-looking things. Not something we use often in general surgery. They almost look like little mustaches with attitude, but they worked. Then came the coolest part, the graft itself. So the attending brings out this slinky-looking tube. It's flexible, coiled, and we even cut it on a slant to match up with the artery. I couldn't unsee it. This thing looked exactly like a toy slinky, but sterile and made to carry blood. We sewed it in, meticulously, stitch by stitch, with the attending guiding me, correcting my technique. Hold the heel of the needle, flip it to the ceiling, yank gently. I was eating up the tips. Seriously, some of the best hands-on teaching I've had in weeks. But of course, right in the middle of our grafting moment, chaos broke out. The attending gets paged to an emergency in the theater next door. Apparently, a patient was having a massive bleed. Someone had ripped out a tumor that was attached to a vein, and the vein came out with it. There was blood everywhere. Total disaster. So he bolts out of the room mid-case, runs next door to literally save someone's life, and then comes back like nothing happened. Casual hero status. Back in our OR, we finished the first anastomosis, unclamped the artery, and of course, we find a leak. So what do? We cut it all out and start over. More time, more sutures, more learning. Honestly, I didn't even mind. Watching the repair process, doing it right, was kind of satisfying. Then came the tunneling. If you've never seen this before, it's wild. You basically push a rod-like instrument under the skin, through the fat to create a tunnel for the graft to pass from the groin to the knee. It feels kind of medieval, like you're digging an escape route through the body, but it works. And it's aggressive, but efficient. We attach the second end, suture it all down, and close the whole thing up. By the end, I was just buzzing. So much anatomy, so much technique, so many moments where I got to actually do something and not just stand in the corner holding suction. And the attending, amazing. Patient, encouraging, real teaching energy. You know those days that just make you feel like you're actually becoming a surgeon? This was one of those days. So that's today's confession. From poorly shaved groins to slinky veins and blood-soaked emergencies. It was everything that you want from a surgery day, and then some. If you enjoyed this episode, share it with your favorite surgical buddy, drop a review, and don't forget to subscribe for more stories from the scrub life. Until next time, stay sharp, stay teachable, and maybe keep a backup razor in your call bag.